Hi there, my name's Josh French. I'm a sports chiropractor and the clinical director of Chiro Spine and Sports Chiropractic. One of the questions I get asked a lot by patients at clinic is what's the best to use out of ice or heat? This question comes up a lot and there's a lot of conflicting information out there on the internet. When you look at the research and evidence on this topic, however, the answer becomes a lot clearer. Using ice for injuries became popularised due to the RICE method, which stood for rest, ice, compression and elevation. The purpose for this protocol was to help reduce swelling on a recent injury and help reduce the overall healing time required. However, we now know that for short-term injuries, inflammation is actually an essential part of the healing process. Within the first 48 hours, as much natural inflammation as is tolerable should be allowed to occur. Taking anti-inflammatory medication like ibuprofen during this first 48-hour phase can actually slow down the overall healing. Instead, for recent injuries, it's best to adopt a police protocol. This stands for protect, optimal loading, ice, compression and elevation. The important difference between the RICE protocol and the police protocol is that for the police protocol, a lot of emphasis is placed on the optimal loading that's required on the injured tissue. The RICE protocol involved resting the injured area. However, on the police protocol, it's best to optimally load the area to strengthen it as much as possible. We know from research that ice has a very negligible effect on the overall swelling levels. However, it's still an important part of the police protocol because it helps to numb and desensitize the painful area. Numbing the area can therefore help to restore normal movement to the area, which will then help the muscles and the joints recover a lot quicker from the injury. Heat, on the other hand, is useful for reducing muscular tightness and a feeling of overall tension in the body. This is normally most effective for long-term chronic problems that involve a lot of tension building up, particularly around the neck and shoulders. Thanks for watching. If you have any questions, comment below and have a nice day.